how do you and physical therapists coordinate care plans to ensure a patient's supported holistically?
We come up with our diagnosis first, right? And we're like, all right, this is what we think is going on, X, Y, Z. And then we'll be like, okay, let's start some physical therapy. And then a lot of times we'll get physical therapy like, okay, we've worked on this. And again, depending on the patient's feedback too, we're like, yes, we did all these things and I'm feeling great. Or we can be like, yeah, we've made some progress, maybe like 50-60% improvement in pain, but we're not quite there yet. They work with physical therapists, and sometimes, if you cannot break through that last little bit, I might get a feedback from the physical therapist saying that, hey, this is some areas that we've been working on, not really breaking through. See if we can maybe do some treatment, something like prolotherapy or PRP, and then see if we can sort of break through that last little bit, so we can kind of like go back and forth. But if it's something that with the physician or the therapist, if they're like kind of stuck and they can't figure out where the symptoms are coming from, then obviously getting a more detailed imaging like MRI will certainly help with that. Having all these tools at our disposal and then kind of working with the physical therapist saying, hey, let's try and change this or try and see if we can treat this one specific area. Even from a patient's perspective, they kind of feel great that, hey, that kind of coordination, it gives them more confidence in terms of the treatment too.